I am Dr. Ravendran from the London Clinic, Bone and Joint, Coimbatore. Now, what are we going to talk about today is about arthritis. Now, arthritis is a worldwide problem. You know that. It's a very common problem in orthopedics, and it affects in various ages, starting from very young to the very old. The diagnosis is same, but the pathology, what is causing arthritis, is different in different ages. And the treatment could be different in different ages. If there is a common thing what we think about is osteoarthritis, which affects the joint, maybe the knee joint, maybe the hip joint, which is common, affecting up to 40, 45, 50. And that we call it as osteoarthritis, தேய்மானம் அப்படிமோ, as an age-related process. Nothing else affects. It's a normal age-related degeneration of the joint. Now, what can be the treatment for it? In common, in earlier methods of treatment, or can I say that again, in the earlier methods of treatment, in the sense that earlier the patient comes in to us, the methods of treatment is different from what we see as the patient comes later on, which means when the severity increases, the management changes. So when the patient comes early, we can always treat them with the medical methods. Means only the tablets, like Sinutab is a fantastic tablet. It does work very well as a synovitis. And there are other tablets like aflapin, curcumin, bonsalic, hyaluronic acid, then like collagens, native collagens. Now there's so many things which have come in the market now, when compared to about 10 years ago, which was not there. It was just painkillers which was being given about 10, 15 years ago. The whole trend has changed. And if you look at the cardiac status, the cardiac surgery in the last 15 years abroad in the Western countries, the cardiac surgery has come down. In the same relation I'm talking, when that's an osteoarthritis of the patient, there are multiple methods of medical treatment, which is by tablets, which can improve the patient's status, patient's symptoms, patient's mobility, patient's walking. Everything can be improved by simple methods. Now, there are certain situations where we will change our treatment or progress to a different method, which means by injection method, injection in the joint. Let me say one categorically, one injection in selected patients can almost remedy the patient, cure the patient for many, many years. I have a list of patients, in fact thousands. They can benefit from one injection, which can benefit from 3 years to about 20 years. So an unnecessary total joint replacement is not warranted. It can be delayed. A joint replacement on an average from all the international papers is required in less than 2% of patients. So if you have 100 patients with arthritis, less than 2 will come for surgery. Remaining, it's all treated by non-surgical methods. Does not require surgery. So that is the important thing. Surgery is required only in very minimal number of percentage of patients. I would categorically say less than 2%. And the selection criteria for surgical patients is to be very, very stringent to get good results. So, in this era, earlier the better, like what we've been following for many, many years, prevention is better than cure. Earlier the patient comes in, we can treat by medical methods and prolong the disease process on a low level so that the patient can be active and mobile for a longer period of time without any surgery. Thank you very much for watching.